talking about the method for testing, we've been traditionally using nasopharyngeal testing. That is, using a small, thin swab stick, passing it through the nostrils all the way backwards towards the back of the nose. And while this has seen very effective collection of samples for testing, giving us very good results, we are very mindful that this is not a pleasant experience. And for individuals who have to do this on a very regular basis, currently the construction workers, those in the CMP sectors have to do this every 14 days. This can be, over time, a very traumatic experience. Sometimes, if this is done forcefully, you can even have nosebleeds, and therefore the workers might develop some aversion to wanting them to comply and continue with this process of regular testing. So we've been exploring different other ways of sample collection for our tests, and what we're doing now, and we are rolling this out progressively in phases, starting with our regional testing centers, and we hope to extend this in all other test settings, including in the hospitals, in the polyclinics, is to use an alternative means that can give us also a good sample, but hopefully without such a high likelihood perhaps of discomfort and potentially other complications. So this involves using a swab stick again, but instead of passing it all the way towards the back of the throat through the nose, it's just midway. And to where we in medical terms, we describe this as where the middle turbinates are, and getting a sample there, supplementing it with a second sample that comes from the back of the throat. Over time, we will be also studying whether or not we actually need these two sites for sample collection, and whether or not we might be able to dispense with one and just stay with one particular site of collection, but we need to validate those processes, and we're in the process of doing so. We are also committed to explore other possible methods, and that includes obtaining deep throat saliva specimens to see whether these might be effective alternative ways for sample collection for testing. But our studies are still in progress, and we are not currently in a position to shift towards using saliva testing at this point in time. So that's one part in terms of our way of trying to make testing a much more pleasant experience for those who are subject to testing regimens. Together with MOM, we've also been discussing whether we can be more proactive about picking up infections as early as possible. And this is in particular in high-risk settings where workers might be staying in dorms with communal living. They are going out to work. It is difficult to completely prevent mingling that takes place. So the environment is rich for a high risk for spread to take place very rapidly if any one individual within that community gets sick. And rather than just simply depend on the high precision and accuracy of our tests, we think it's also important for us to explore other ways of varying our testing, our surveillance. And one option that we are studying very at this point in time is to increase the test frequency. We test more often to see whether or not this can give us an opportunity to detect infections earlier and allow us then to intervene more decisively to break up chains of infection, prevent them from forming large clusters, and therefore allow for an opportunity for workers to continue to work in a safer environment, and also to prevent the disruptions that will take place when large numbers of workers have to be quarantined as a result of picking up positive cases during these testing regimes. So we will be starting off with doing the study in one of our dormitories, and we will start off with a 7-day testing cycle. And we may, at the end of the study, decide whether this is a regimen that can be safely extended to other dormitories. It may also allow us to think about more tiered approaches where higher risk dormitories might engage in higher frequency testing, whereas other dormitories might engage in the traditional 14-day cycle. So we are open to these possibilities, but we need to test and study this more closely. And we'll start off first with the study that we are doing in this particular dorm.